that I've had asthma. I was in the hospital 26 times. And one of the stories that I recall the most is about 6 days before I was going to get married, I had a severe attack, and my soon-to-be wife, who's in the audience, was called by the ER doctor and said, "You need to get here immediately. I need to talk to you." And she got there, and he said, "I've never seen a 29-year-old like this. I don't know if he's going to live or not, so you're becoming the POA immediately." Yes, the power of attorney for healthcare. And so, thank goodness, by the power of prayer and the power of knowledge and base, and see what we can do for you. So I had BT performed, bronchial thermoplasty. And that procedure was very successful. That was about 26 months ago that I had the last treatment performed. I have lost 40 pounds since then. I'm no longer dependent on prednisone like I used to before. I was on that for 7 years straight. I no longer have to take breathing treatments 4 times a day. And all my other health conditions that I developed because of the medications for the asthma are now getting better. So because of my experience, I want to help other severe asthmatics out. So I've developed my own support group for asthmatics that physicians hand out the cards that actually perform the VT procedure. So I'll discuss that at the end, but that's my history, and I just wanted you to know about that.
Wow. Let's give him a hand. The next gentleman is one of the foremost experts on asthma. Matter of fact, I know that because one of my parishioners, her name is Queen Esther Thompson. And I will not give her age because she is ageless, and she would find out if I did right now. And Queen would come to church, and when she saw his name on the flyer for this particular event, she just says, "I love him. Dr. Fox is just incredible." And the only thing, though, the truth of the matter, Queen couldn't be here today because of the weather. And so we do have a lot of folk that are asthmatic who, because of these conditions, couldn't be here. But I just want to just say, Dr. Fox, I thank you for the work you've done with Queen and other people like her, and we so appreciate you being here with us today. So, ladies and gentlemen, Dr. Falls.
Well, thank you, Pastor, for the fine comments, and good afternoon, everyone.
Hello.
I'm an allergist, immunologist, board certified in that specialty as well as internal medicine by practice exclusively allergy and immunology. I'm also an asthma specialist. So I wear several hats within the greater metropolitan Chicago area / Illinois. I'm chief of allergy and immunology for Advocate Medical Group of Advocate Healthcare. I'm also president of the American College of Allergy, Asthma, and Immunology, which is the oldest academic body of allergists in America and some 90 other countries. And I also serve on the board of the Respiratory Health Association, and I recommend that you log on to their website because they have some very valuable information about all respiratory diseases, including asthma, COPD, and other diseases that involve lungs. In addition to those responsibilities, I have tremendous interest in indoor air quality. We talk about outdoor air quality frequently, and it is problematic, especially in urban areas. But indoor air pollution is the leading cause of illness in comparison to outdoor air pollution. And indoor air pollution includes some components which we can discuss a bit later that you might find surprising that are detrimental to the airways and can indeed aggravate asthma, as well as a variety of other respiratory problems. And I think Mr. Kenny Meyer here exemplifies the kind of patients that I manage who have refractory asthma that doesn't respond well to standard